Nigeria is making plans on how to increase access to more COVID-19 vaccines as part of efforts to sustain its vaccination campaign. Minister of Health Osagie Enahire, who announced these at the weekly presidential media briefing held at the Presidential Villa Abuja, said government is lobbying European countries for more vaccines. Galaxy's correspondent Nabuchi reports that Nigeria plans to vaccinate about 70% of its population by 2022, but hopes of achieving that target looks gloomy as the shortage of vaccine supply is a big challenge.
And what we are doing now is approaching countries. We do what we call bilateral. Bilateral is that you approach certain countries who have surplus or who have declared they have surplus and say, will you share with us? So that's what we're about to start doing. Some countries have announced publicly that they will share some of their vaccines. Right now, they are doing donations to make money available for COVAX, which is very good. But the point is that all that money immediately will not translate into vaccine because you won't get it until months later. So we're looking for those who want to share.
The federal government is now forced to change its tactics in administering the first batch of AstraZeneca vaccines 3 months after it was received. Only about 2 million people will now be fully vaccinated instead of the initial 4 million proposed. That's because about 29 million doses of the Johnson & Johnson vaccines are expected by August. The shortage of supply is raising lots of questions about local manufacturing. This has sparked conversations with international organizations.
1,961,883 of the targeted eligible Nigerians have been vaccinated with their first dose of the Oxford AstraZeneca vaccine. Now, of this number, you will recall that we had actually prioritized the different people that will be getting in the first phase of the vaccination campaign. 66% are actually frontline workers, 22% are healthcare workers, while 12% are those that are 50 years and above. Similarly, about 148,258 Nigerians have already received their second doses across the 36 states and the FCT.
It has been very limited because there are countries that give us the vaccines, but who at the moment have only promised to deliver many months from now. They want to take care of their own needs first, their own citizens and their immediate environment. The 4 billion, over 4 billion doses we have received so far have all come from India. And as you all know, India is facing serious challenges right now with COVID infection, massive COVID infection, which is necessitating their turning their vaccine production to themselves and to their neighborhood. And they have told us that they can't supply us yet until a bit later in the year. But even what is happening in India is an example of what we want to avoid. We want to be proactive, we want to be preemptive.
Government says it is increasing testing, improving therapeutics and taking precautions to prevent a third wave.
In terms of preparing, we definitely don't want another spike in cases, but we realize that sometimes it's out of our hands. So just like the Honorable Minister said, working very hard to ensure that our care facilities have the oxygen that they need. And we've also kept our laboratories going across the country and actually activating new ones every month. We've built new state-of-the-art treatment centers in 16 states, and we plan to complete that for the country. 2 new ones will be commissioned this month in Kebbi and Katsina states.